to meet you. I'm gonna be your physical therapist today. Have you been here before? Okay. I didn't think so. I do have the referral from your primary care doctor. So, just look. I believe you were in an accident. Okay. Right. Okay, well, that's understandable. Especially with those type of accidents and situations. Your body is going to be, in a bit of pain, discomfort, and hopefully we can look you over, work on some moves and stretches that can help you feeling better and much more closer to what you were before the accident. Yeah. Usually our main focus here is to relieve some pain for you because we don't want you to be in discomfort. Exactly. And as we continue with a few more sessions, yes, the minimum is 3, and then at that point we will judge you on the progress you've made to see if maybe your body needs a few more sessions or if you're good to go. We will be sending you home with, it's not really homework, but some stretches and tasks that you can do throughout the course of your day that will also help to improve your pain level and just, getting your body back to the way that it was before the accident. Yeah. It is an unfortunate situation, but trust me, I'm going to work my hardest to get you feeling much better. Okay, good. I do want you to feel comfortable with me throughout all of this, so if you have any questions, comments, concerns, please let me know at any time. I am also going to be moving closer to you, touching and helping you to move your arms and your body and so on. If anything is causing you a lot of discomfort, please let me know. Okay. Good. So, just to start off, I do have a little bit of a form I'd like to go over, just because I want to make sure that I understand how exactly, this accident has affected you and so on, okay? Okay. So, can you just confirm your name for me? Okay. And your date of birth? Okay. And today's date is... Oh. Okay. The month is going by so fast. Okay. When would you say the symptoms start date was? So is that the same day as your accident, or sometimes people's symptoms will come in the next day or even a few days after an accident like that? Okay. So pretty much the same day as the accident. Okay. And have they progressively gotten worse? And if you could possibly describe some of your symptoms. Now, I know you're in some pain and discomfort, but is there a throbbing? Is it just a constant pain? Is it kind of a shooting pain? Is there any sort of tingly or numbing sensation in any of the areas? And is that on your shoulder, neck? Okay. And what about your arms and leg? Yeah, do you feel any numbness down your legs or anything throughout any of this? No. Obviously, I stated that our goal for you would be to get rid of some of that discomfort and that pain. What is your main goal from this physical therapy? Is it the same or... Okay, so pain relief, totally understandable. Better mobility, yeah, okay. And that should come hand in hand. If we get some of your pain and discomfort under control, you're going to feel a lot more relaxed and able to move much easier, and it will kind of get you back to where you were. Now, how often do you experience these symptoms? And that can be in any of the neck, head, shoulder, arms, legs, any of these symptoms that you are experiencing, okay? Just kind of loop them together. So how often? Constantly would be 76 to 100% of the day. Frequently would be 51 to 75% of the day. Occasionally would be 26 to 50% of the day. Intermediately would be 0 to 25% of the day. So if you think to an average day for you, how often do you experience these symptoms? Okay. And I know you described the symptoms, but let's just make sure any of these apply to you. Sharp pain, dull ache, numbing, shooting pain, burning, and tingling. Okay. Would you say that your symptoms are getting better, not changing, or they're getting worse? And are the symptoms worse in the morning or afternoon? Do they increase during the day? They worse at night? Or is the symptoms pretty much the same throughout the course of your day? Yeah, so morning, afternoon, increase during the day, nighttime, or they're the same all day long. And when is the pain worse or better? Is it better or worse for you standing, sitting, or laying down? Okay. Would you say that these symptoms have interfered with your work life? Yeah, it's definitely important for us to know. Yeah. What is your occupation? Okay. Have you been able to do sort of light duty since the accident? Okay, good. Good, yeah. You know, some jobs don't really care, but it's nice that yours seem to be working with you. Okay. And your general health, would you rate it as excellent, good, fair, or poor? As of yet, have you seen for this specific incident, not so much in the past, but since the accident and since these symptoms have arose for you, have you seen a chiropractor, a medical doctor, or another physical therapist? Okay. Now, at that primary doctor, did they go ahead and run any sort of tests such as x-rays, CTs, MRIs, or other? Okay. Did you go to emergency room after the accident? Good. Now, have you had any similar problems or symptoms in the past that could have been triggered by a different incident? Okay. So this is a relatively new injury. You haven't really experienced something like this before? Okay. Yeah. Yeah, it's really unfortunate when these type of accidents happen to people. But like I said, you're in really good hands. We're going to take care of you here, and you're going to be feeling good as new. Okay. So, can you just let me know if any of these conditions apply to you? So, high blood pressure, heart attack, stroke, asthma, tumors, lupus, epilepsy, diabetes, arthritis, and are you pregnant right now? Didn't think so. Okay. All right. Let's see what else we got here. Any sort of a tobacco use? Any sort of recreational drug use or alcohol use? What about caffeine? Coffee, teas, energy drinks, anything of that nature? Do you feel like when you have some caffeine, it helps to keep you going a little bit with the discomfort? A lot of people like to think that have a couple cups of coffee gets the energy going a little bit, and you're able to fight through some of those symptoms a little bit better. Yeah. Of course, we would prefer to work on some stretches with the muscles and healing the body, and not so much just covering it up, whether that be with a pain medication or, just grabbing a bunch of energy drinks and just kind of power through the day. We'd kind of like to heal the problem from within. Yeah, okay. And have you had any hospitalizations within the last 2 years? You did visit the hospital after the accident, yeah? Okay. Did you stay overnight? And there were not any surgical procedures as of yet, correct? Yeah, that's what I thought. For the most part, we would really like to avoid surgery. From what your primary care doctors telling me, and from what I've looked over your situation, I don't think that you're necessarily a candidate for any sort of back, shoulder surgery of any kind, because I really think that we can get to the source with just some good stretches and movements and some different practices that we can kind of get your body back in shape, if you will, okay? Those type of surgeries can be on the serious side, so we try to avoid them if possible. If it comes to the point where you do need surgery, then that's fine, and we have a fantastic team within our clinic and your primary care's clinic. And post-surgery, I would be happy to help and work you through that physical therapy as well. So don't focus too much on the idea of surgery, because right now you are several steps away from that. We still have a few sessions between us to get you better than new. Okay. What else? Any medications you were taking? What's the dosage? And then if I could just get your current weight and height. Get a visual for what are your problem areas before we start stretching, doing some movements, before I start touching or doing any sort of massage on your muscles. And I want to make sure that we're in an understanding of where a lot of your discomfort is. While a lot of this will be a little bit uncomfortable, it should not be painful. It's just the, stretching a sore muscle sort of feeling that can be a tad bit uncomfortable, but it's going to work to heal and progress your body in a positive direction. Okay, so if we were to look at this diagram here, where would you say your main problem areas are? So if we look at the front of you, I know that neck and shoulder have been the main problems, with some symptoms moving down to the arms and legs. Okay, so from the front, is the neck a problem? Down to the collarbone, is that a problem from the front? Okay, and what if we went down to the shoulders from the front? Is this a problem? Do you notice symptoms there? Okay, so both shoulders from the front. Now your arms from the front, do you notice? Okay, so just little bits down the arms, and that's going to be same from both sides basically. Do you have any sort of problems down your chest? Even any sort of tingly sensation into your stomach? Okay. Now I know you're having some, discomfort in your legs as well. Would you say that that's from the front? You notice it at all? Okay, so we'll just do little bits, just to check in. Not so severe, because I know the main concern is going to be these circle parts here, but we do want to make sure that if you are continuing to have numbing or tingling sensations down your legs into your toes, that we're making note of that, okay? Now from the back, the neck from the back, yeah, okay. Now does this go up into your head? Are you experiencing migraines or headaches? Okay. Yeah, these are really just kind of notes for me so I can monitor your progress. Then from the back, does it go down into the shoulders, your back too? Yeah. And what about further, like more of the shoulder blades? Yeah. And the spine as a whole, would you say that you if you were to kind of move and stretch, just at the waist and adjust your spine, do you notice symptoms there? And then I'm just going to make note of the arms, little dashes, just because of that tingling and numbing sensation, which is, of course, connected to the issues that you are having with your upper body right now. Okay, I'm going to make the same notes with the legs, just to keep that in mind, the tingling sensation and whatnot. I want to definitely keep an eye on that. Okay, so that looks about right. Really going to be focusing on that. And then just for kind of your reference here, this is kind of a normal spine here, and closer to yours. This isn't yours exactly, but because you've sustained a trauma and your spine is a little bit out of whack, your shoulders and neck are misaligned and whatnot. So these red points here are a good indication of those problems. So if we were to do this on you, you would have some red points, clearly on your neck. Could even go up into your head because of those headaches. Your shoulders, both sides, shoulder blades, down your spine. You'd have these red marks that are problem areas that hopefully, as we progress together, you do your exercises at home, your stretches, we work together, we can get your spine, your body looking more healthy and aligned. Exactly. Okay, so that is most definitely the goal for us, is to get you feeling better. Making sure that your upper body is healed in a positive way, but also not causing additional symptoms to your lower body. Okay, let me just put this in your file here. Good. Okay, so now to get started here, I'm just going to, let me just have a look at you real quick. Okay, Okay, so yeah, you just try to stand up straight a little bit, unless it's causing you a lot of pain, but straighten your shoulders if you can. I just want to see what your regular posture and stance is at this current moment. Okay, so let me just see. Yeah, don't worry, you just breathe normal, close your eyes, whatever you need to do to relax. I'm just kind of having a little look-see since this is our first meeting, first session. Okay. 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 Good. Alright. So I'm going to do just a couple little reflex tests. So let's start with your arm. I can see your arm. I'm just going to tap it. Your elbow. Yeah, tap your elbow. Okay, so just, yep, relax. Let me have your arm fully. Again. Okay, and down. I'm gonna do the same thing here. Let me have your arm here. Yep. Nice and loose. And okay, good. One more time, just let me hold your arm. I gotcha. Okay, good. Good. I'm gonna do the same thing with your knees now. Okay, so yeah, you just, sit there and kind of let your feet dangle off a little bit, okay? Good. Okay, ready? More. Good. And this side here. Okay. Okay. Good. Good, good. Now, let me see about your arms. Let's go ahead and can we lift your arms up? I am going to assist you. How's that feel when you have your arms at that level? Okay, back down. We're going to work on this arm here. I want you to lift up your arm, and I'm going to be pushing down on it, and I want you to resist me and just keep that arm nice and strong, okay? Okay, so just stretch your arm out, nice like this. Just keep it nice and strong for me. Okay, you ready? And resist. Okay. Good. And resisting that, does it cause you any sort of discomfort? Okay. Now take that same arm and you're gonna have it up like this, and I'm gonna try and pull your arm towards me, but I need you to stay strong and keep it just right by you. Okay. Ready? Yep, have it up, kind of like a fist. Okay, like that. Ready? Good. And relax. Same thing on this side. Let's have the arm straight out, and you're just going to hold it nice and strong while I try and push down, and just resist for me. Good. Okay, ready? Okay. So that one's a little bit weaker. A little bit. Same thing, make that fist, hold it to you. I'm going to try and pull, but you just resist me. Okay. Okay, good. We're going to do the same thing with your legs as well. So first, I need you to, lift your leg straight out, kind of like we did with our arms. Okay? Yeah, just lift your leg out like that. Good. Good. And I'm going to try and push down on your leg. I need you to just resist and keep it up. Okay. Okay, back down. Now, I'm going to try and pull your lower leg out, but I need you to stay strong and your arm, just keep it in close to you as I try to pull out your lower leg. Okay, so ready? Okay, and relax. Now same thing with this leg, straight out in front of you. I'm going to try and push down on your leg. You just resist me. Okay, you ready? 1, 2, 3. Okay. Okay, relax. Alright, and now once more I'm going to try and pull out the lower part of your leg. You just stay strong and resist that. Okay, you ready? Okay. Alright, back down. Okay. Now I know that this is kind of a sensitive area, so I want to do a little bit of that with your face and your neck, but nothing too extreme. So if you start, feeling a lot of pain, feel a little woozy or lightheaded, please let me know. Okay, so just turn your face into just kind of turn and resist as I try to hold your face in place. Ready? Good. Good. Same on this side. Resist. Good. Perfect. Okay, and if I try and push your head down a little bit, can you resist that? Excellent. And if I try and lift your chin up, can you resist? Good. Good. And how's the pain level on that? Okay. Okay, let me just make note of that real quick for you. Let's see here. Okay, you did really good with the resisting. Your muscle is still pretty, strong, which is very impressive, which is also a good indication that you don't have a lot of damage. Just got a little bit of things to work on to get you back to where you were, which is perfectly fine. Okay. Alright. So now I'm going to be lifting your arms, your legs, even kind of moving your head a little bit. I want you to go completely loose and limp, wiggly, jelly, whatever you want to say, and just let me take hold. And I'm going to be moving your arms at different places, your wrist, your fingers, everything like that. Same with your legs, just kind of moving around and seeing how you do with those movements. If the pain gets worse, if there's any muscles that are super tense when we lift, anything like that, okay? Okay, so we're going to start with this arm right here. Just let me have it in my hand, and you just relax. Okay, so lift up, up. Good, and down, up. How's your shoulder? Okay, and now stretch back a little bit. Yeah. Okay. Up. What about bending that arm? This wrist. Wiggle those fingers. Okay, and down. Good. Gonna do the same thing on this side. So just let your arm rest in my hand. Okay. And up. And down. Up. Okay, and down and out. A little bit back. Out. Does that hurt there? Okay. And what about if I stretch like this? Okay. And if we move your arm and your shoulder kind of at this angle, how does that feel? Okay. Back down. Good. Now your legs. Once more, just let your leg rest in my hand here. moving side, side, bend. Any of that hurting? Okay, good. And down. Same thing on this side for you. Just let your leg rest in my hand. And back down. Good, good, good. Okay, and I'm gonna move your head a little bit, okay? Okay, bear with me here. Okay. 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 How's that feel on your neck? Just slight movements. Okay. Okay, and a little bit. Down, 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 a little bit. Hold there. And back up, 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 up. Okay. See. From behind here real quick for me. Just see there. Okay. Just, yeah, I got your hand, so you just relax for me as best you can. I know. Just trying to get an idea of how much movement you have. Good. Okay. So a little bit tense and uncomfortable. That's understandable. Let me just grab your chart here. Okay. So you do have, a decent amount of movement, even though it is a little tense. That's to be expected with this type of accident. But yeah, your muscle movement is actually very impressive. So yeah. Okay. Let's see here. Okay. So next up, I do want to try a few different stretches. You're doing really fantastic, so I just want to see how we're doing. Okay, so first up, I want you to lift your arms like this. And it can be lower if it's better, kind of at an angle, or it can be straight, whichever is good for you. Yep. Now that we have our arms straight out, we're going to make little circles. Circle, 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 circle. Yep. Little circles. Circle, 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 circle. How's that feel? Okay. Tense, but is it bearable? Okay, just circle, 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 circle. Circle, circle, circle. Circle, circle, circle. Now make the circles bigger. Big circles, big circles, big circles, big circles. And you don't have to do it as fast as I am. If you need to do it slowly, that's totally fine. Okay, big circle, big circle, big circle, big circle. Good. Big circle, big circle, big circle, big circle. Good. Okay, and rest them at your side. Rest. Breathe. I know. It's a little bit uncomfortable, but you're doing so good. Good job. Take a nice couple deep breaths. Stretch out that shoulder a little bit. I want you to go ahead and kind of bend your arm and tuck it back behind just a little bit, kind of like this hand here is reaching for your shoulder blade on the opposite side. Okay? Yeah. And you don't have to reach all the way, just as much as you are comfortable to reach and stretch a little bit there. Okay? Yeah, let me help. Okay? No worries, you're doing good. Good, okay. Yep. Just kind of let you feel like your fingertips are reaching, but you don't have to completely reach. Palms there, okay. Good. And down. Now let's do the other side. Reach over and just can hold if that will help you, or you can just work to stretch. Stretch. See what it looks like from the back here. Okay, yep. No, don't worry, you don't have to be an overachiever. I want you to do this nice and easy. None of our sessions together should make you feel any worse or cause any sort of discomfort. There may be soreness, that's just part of the healing process, but there should be no other damage or anything like that. So take it easy on yourself. We have time. And back down. Good. Now, just, relax a little bit. Roll your shoulders. Yeah. Roll. Yeah. Okay. And let me just see how your posture is. Let me see how this looks. Right. And now I want to kind of lift your arms straight up. I know that might be difficult, so we'll see how you can do, and I'm going to be right here assisting you, okay? So try and start to lift your arms up. Yeah, okay. Yep, I'm going to help you hold there a little bit, okay? And let's just stretch that, and down. Lift them down. Okay, we're going to go right, and up. And down. Okay. And up. Lift those arms up to the sky, up to the sky. Good. And down. Okay. Good. How's that feel? Okay. Let's just do one more. And lift those arms up to the sky. Good. Okay, perfect. Okay, so next up, we're just gonna try and have you move your head a little bit, but still make sure that it's not causing you a lot of discomfort or pain. So if you can just kind of relax a little bit and start to move your head this way. Yeah, just move your head a little bit like that. Perfect. And if it starts to kind of pull at your muscles, that's okay. You can just move back to the center. Good. And then this way. Good. And back to the center. Good. And then let me just see real quick if I can just... Good. Alright, we're going to go one more time to this side, so turn your head to this side as far as you can stretch. That's comfortable for your muscles. And then back to center. And then this side, stretch again. And then back to center here. Good. Okay, let me see real quick. That feel okay? Okay, good. Perfect. Okay, let me just make a note of that real quick. Okay, so let me just gonna massage a little bit of your muscles here, just because you've done a lot of stretching now, so let's just... Does that feel okay? Good. Just kind of squeezing and releasing those muscles in your neck and your shoulders. Okay. So good. This side here for you. Squeeze, squeeze, squeeze. And this side here. Your neck feel a little bit better. Okay, just gonna move to the back of you real quick. Get some of those muscles. Good. Perfect. Now, I did just want to do a little bit of a more intense massage with this little massager here real quick. Not going to be too over the top for you, but just kind of to pulsate a little bit of the neck and the shoulders. Since you did do a lot of stretching today, I want it to be more relaxed when you leave. Okay, so just hold still for me. How's that feel? And this side here, just want to make sure that it feels a little bit better for you. Work that shoulder out. Okay, I'm just going to go behind you once more. Get your shoulders up your neck, both sides, and a little bit down your spine. It's just kind of a light pressure, nothing too intense for you. Okay, does that still feel okay? Good. Good. Just a little bit. this ice pack here, I'm gonna have you switching from ice to heat, kind of back and forth. This is just a basic ice pack that you can get in a local drugstore, nothing fancy, but I want you to place it different places along your neck mostly. If you feel that your shoulders need it too, feel free to ice that as well, but mostly I want to focus on your neck right now because your neck is causing a lot of the tension that is further moving down into your shoulders and into the rest of your spine, your arms, and your legs. Okay. So I'm just going to place this on your neck, kind of just around the back like this, and kind of mold it around your neck, okay? So we're just going to kind of fold it so that it fits nicely around your neck. Okay. Here we go. There we go. Okay. Now we're going to let that sit there for a few moments before we continue and switch to heat, okay? So let's go over some of your homework. I would really like for you to just do the basic stretches that we did today. So some of the arm lifting, just to kind of get, you might feel a little bit like a bird, but just to get kind of some motion in your arms. And if you can put them out and do those circles, you can do the stretches like this and like this. Depending on how your shoulder is feeling, you can do it across your body as well. Stretch, stretch, but I don't want you to pull too much on the shoulder, okay? Just give it a nice little stretch, nothing that's pulling or yanking the muscle too much, okay? As for your head, if we can just do, a little bit of holding, like that, your head up straight, and kind of to the side, middle, side, middle, and look to the sides. Look, middle, look, middle, as well as up, middle, down, middle. Okay? So, do, 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 do. And if you'd like to end it off with a nice, slow, and long neck roll. There you go. And back the opposite way. Good. For as many times that is comfortable and fit for you, okay? Let me just check that ice back here. Okay. Okay, set that there. Grab this. Now this is a bit of a heating pad, and it's going to be specifically a neck heating pad, although I can offer you some that go further down the back. But this is basically going to sit and rest on your neck like this. It's very soothing. I'd recommend if you start with the ice and then switch to heat, this is very relaxing. So if you're experiencing some pain at night, it's very soothing to do the heating pad on your neck here. I'm just gonna pop it on your neck. It's very soothing to do it right before you're going to be laying down and resting. So yeah, okay. Good. Okay, so do you have any sort of questions for me, comments or concerns before we finish this session today? No, I think you did really good, especially for a first session. We're going to have 2 more confirmed that are already on the books, and then we'll assess you from there if you need to do any further sessions or if you'll be good on your own. I will be communicating with your primary care doctor as well. Okay? So you feel free to sit there and relax with this heating pad for as long as you need to. Okay? It was very nice meeting you, and I will see you in your next session. Bye now.